welcome, Senator, and I look forward to continuing to work with you on Taxpayer Right to Know and a number of other key bills. Senator Ossoff.
Thank you, Madam Chair, and thank you for all of your work fighting abuse, waste, duplication in the federal government. I'm appreciative. Comptroller General, nice to see you. Appreciate your dogged, determined, and independent-minded approach to your job. You're a great asset to the Congress and the taxpayer. I'm going to expand the scope of this discussion a bit into some recent work that GAO has undertaken with a particular focus on the opioid crisis and its impact on families and communities in the state of Georgia, and on consumer product safety for families with babies and young children. Just to set the table, in brief, what kind of follow-up does GA do to assess whether or not agencies to whom you make recommendations for change or reform are indeed undertaking such change and reform?
Yeah, we have a regular recommendation follow-up process, Senator. At a minimum, every 6 months, we check in with the agencies and we report on that. For this overlap and duplication work we do, for example, every year we follow up and we issue we have a public called Action Tracker that says what the agencies have done, what they yet need to do. So it's a very rigorous process for follow-up. And when I also send a letter each year to every agency head across the federal government listing priority open GAO recommendations that they haven't yet implemented to try to get them to move in that area. And then lastly, where we see the agencies not being responsive in a timely manner, or not at all, we'll work with the Congress to try to get the Congress to require the agencies to implement our recommendations. Regularly, every year, appropriation bills have many provisions requiring agencies to implement GAO's recommendations.
I appreciate that. And the crisis of opioid addiction, abuse, and overdose has impacted Georgia as it has every state. Georgia Department of Health says that all drug overdose deaths in Georgia increased by 55% from 2019 to 21. And to help address this problem last year, Senator Grassley and I introduced and the Senate passed our Rural Opioid Abuse Prevention Act. GAO undertook work June of 2022 report with recommendations to DOJ and DEA about developing guidance for registered drug distributors meant to help ensure the availability of medicine for legitimate use while limiting the availability of dangerous opioids for abuse and for diversion to illegal markets. So what I'd like to do is ask for you to affirm, as I'm pressing every relevant agency in the federal government to intensify their work to reduce the destruction wreaked by opioid abuse across the country, ask for you to affirm that you are continuing to monitor DOJ and DEA's progress in implementing those recommendations, and ask you for a commitment and indeed an affirmation that you will, as you typically do, report to my office, this committee, and the Congress with the progress that you're making to help save lives on this issue.
Absolutely, Senator. You have my commitment on that. There's proposed regulations out to deal with implementing our recommendations on the suspicious reporting and to put more guidance out to the agencies to codify the legal requirements for providers as well as to provide additional guidance to them on how to report suspicious ordering activities as well. And my understanding is from my team is that guidance is due to be a final regulation next month. So we're monitoring those two recommendations we have for Department of Justice and DEA as well. Now, I might also point out, Senator, that I've designated drug misuse as a high-risk area across the entire federal government. And we have a number of recommendations open. We're happy to brief your staff on that high-risk designation. In fact, yesterday I talked to Dr. Rahul Gupta about the national strategy. I put it on the list because we didn't have a national strategy. There really wasn't good coordination among federal agencies, let alone at federal, state, and local level, with law enforcement, healthcare providers, people in treatment options, and others. So I'm very concerned about this issue. I share your concern about it, and you have my commitment that we will do everything we can to ensure our recommendations are implemented and that we can effectively keep you apprised of those efforts.
I appreciate that commitment, and I want next to discuss something that I know is top of mind for every parent in Georgia. And as the father of a 6-month-old baby daughter, something that I can relate to intensely, which is the concern about the safety of the products that families buy, whether it's strollers or cribs, that are under the regulatory purview of the Consumer Product Safety Commission. And that concern that a product malfunction or an error in manufacturing could lead to the death or serious injury of an infant or a young child. It's every parent's worst nightmare. In recent years, the CPSC has obtained the recall of certain products that pose risks to maternal and infant health. You issued, or the GAO issued in November 2020, several recommendations for the Consumer Product Safety Commission in terms of the management of case processing, investigative timelines, and how it measures the effectiveness of its recalls. How can we help make the CPSC system as timely and efficient and effective as possible at ensuring that no parent has to suffer the loss of an infant baby or a young child because of a preventable defect in a product that never should have hit markets or should have been recalled once it did? And will you commit to the people of Georgia and to my office, this committee, and the Congress that you'll follow up with us on the progress of the implementation of those recommendations, please?
Yeah, absolutely. You have my commitment on that. I'm a grandparent of 7 grandchildren, so I share your concern about this. There's nothing more worrisome than the harm that can occur to an infant or others. We also have an open recommendation to Congress here to create an entity that can ensure effective coordination across the government, solve jurisdictional issues between areas. Also, a high-risk area we have, Senators, on food safety. Our food safety system's fragmented, and so we'll brief your staff on those issues as well.
Thank you. Georgia parents will be relieved by that commitment, and I look forward to continuing to work with you. Thanks for your testimony.
Same here, Senator. Thank you.
Thank you, Senator Ossoff. Mr. Dodaro, I'm going to